Good day, we are the Group 2 from BSN 2A, and today we will be presenting our research entitled Virtual Reality in Nursing Education as part of our requirements in NCM 110 or the Nursing Informatics. But first, let me introduce to you who are the presenters for today. My name is Princess Julia E. De La Paz, the leader of Group 2, and here are my members. Mrs. Stephanie Andre G. Junicio, Miss Sandy B. Elvambuena, Miss Justine May S. Ebron, Miss Stanley May M. Esquejo, Miss Carla Claire C. Estrada, and Miss Julian Denise P. Gregorio. The ultimate purpose of education in nursing course is to encourage the use of theoretical knowledge in clinical practice. Limited clinical practice time limits students' opportunities to gain clinical experience and expertise with actual patients, which results from a lack of clinical practice which prepares student nurses for the real-world clinical environment. This can lead to nursing procedural errors and jeopardize patient safety. We all know that us, the student nurses batch 24, are the first one to enter college via online class in the middle of the COVID-19 pandemic. And we admit that we are lack of knowledge and a zero experience when it comes to the real hospital setting, and we are all afraid to make mistakes that can harm our patient. These problems require solutions, and that certain solution is the virtual reality in nursing education. According to CAL 2019, the virtual world was discovered with the invention of simulation technology, which was initially employed in medical science and military, and later in medical education. The use of computer technology to build an interactive three-dimensional or 3D world in which users feel a sensation of spatial presence is known as the virtual reality. Virtual reality delivers a first-person active learning experience through various degrees of immersion or the ability to perceive the digital world in real time, interact with things, and conduct a series of activities in that reality. Because virtual reality allows for simulation, it is ideal for clinical and procedure-focused teaching. Virtual reality simulations incorporate physical or other devices such as computer keyboard, a mouse, speech or voice recognition, motion sensors, or haptic devices to imitate real-life events and healthcare processes. So imagine, from the first calculator that was made by Blaise Pascal on 1642 and continues to Mark I on 1943 and innovates to UNIVAC in 1951. I am proud to say that the innovations and upgrades for the past decades are worth it. We are the benefactor of it. Virtual reality or simulation refers to using real people to operate simulated systems via a computer screen. It may include surgical simulation models for on-screen procedural training, which are usually integrated with haptic devices to interact with systems. As explained by Fiale and other authors 2019, nursing education is changing as virtual reality technology improves and becomes cheaper. If you are familiar with the economics law of supply, price, and demand, when the supply increases, the price and demand decreases, and this is why technology is cheap and can be utilized or used for all. Virtual reality or VR is increasingly being utilized in nursing education to teach a variety of nursing principles. So, what are those nursing principles? It includes leadership, communication, decision-making, critical thinking, health assessment, and disaster response. Additionally, virtual reality simulations can allow nursing students to practice skills in a safe environment without putting patients at risk. Because we, as the future allied healthcare worker, we should put our patient safety and wellness first. I have here some pictures on how virtual reality works. So the first picture is this article. It is clearly the proof that virtual reality is using on nursing school abroad. As you can see, the professor is teaching the student nurse on how to use the virtual reality. You will also notice in this picture the tools and equipment that was used in virtual reality in nursing education. If you are wondering kung ano nga ba ang nakikita nila when we are using the virtual reality in nursing education, ito yung some samples. You will notice in this picture the vital signs of the patient on the upper left side, and you will also see the usual medical tools that we usually encounter in hospital setting. Lastly, virtual reality in nursing education is applicable to all AI patients even if they are black, white, old, or even infant. The introduction will be continued by Ms. Janicio.
It says here that technology is more likely to be broadly defined to include the medical industry. Dito natin ngayon makikita yung necessity for us to need more of the gadgets that are needed for medical equipment to heal a person because of the new technologies that are arising.
History of virtual reality in nursing education. So, the origins of virtual reality can be traced as far back as the middle of the 20th century, yet breakthroughs only began to take place in the 1980s. So in 1980s, Ollery and VPO researching corporations were the first companies that sold VR headsets and gloves and started to develop sophisticated hardware and software that enable three-dimensional virtual spaces to be produced and explored. Based on my research and understanding, other corporations contribute more on software that enables three-dimensional spaces, while the virtual programming languages or the VPO contributed more on hardware as they were one of the first companies that developed and sold virtual. So next, on 1997, VR technology in medicine. So as the advancement of virtuality started, it commenced being applied in healthcare. As per Moline, an overview highlighted numerous applications including the use of VR technology in surgical procedures, medical therapies, and preventive health, some of which appear in professional practice today. An example of this is the application called Immersive Touch, but as it translates a patient's computed tomography or the CT scan or magnetic resonance imaging or the MRI scans into three-dimensional virtual scans that surgeons in a virtual environment can manipulate the equip for complex operations. Next, clinical trials of virtual reality. So as per Chu, Chen, Yen, and Han on 2018, it includes pain management, eating disorders, and exercise rehabilitation that demonstrate numerous applications of such novel technology. Then based on Li, Chung, and Ho in 2011, there are pilot studies of VR games for children with cancer that have shown that being immersed in these digital therapeutic play sessions helped ameliorate depressive symptoms. And as per Gu, Deng, and Yang 2014, there are instances that VR technology has been pioneered for patients undergoing wound dressing that changes to relieve the pain experienced. Next, for the advanced simulations, first to introduce avatars. So avatars are graphical representations of users in a virtual environment. Advanced simulations allow nursing students to explore role play and use computer-generated interactions with patients or with patient avatars to enhance learning in a risk-free environment. So this type of technology created VR that incorporate multi-sensory feedback to ensure students pick up essential skills and applications in different healthcare contexts, and can also be used in more abstract ways. For examples, by authorizing students to explore human anatomy and physiology at the cellular, tissue, or bodily system level. So all in all, the history of virtual reality in nursing education as comparing the origin of virtual reality and today, VR systems comprise much more progressive, interactive, computer-generated environments that are capable of simulating a range of real-world and imaginary spaces and objects.
We are benefiting from technology all day, all the time. Virtual reality is one of the many contributions of technology in our lives. It allowed people to enter situations that would otherwise be impossible to recreate in real life. Its utilization in different industries have now added great results, and now, association of virtual reality in nursing education may enable nursing students to experience or practice and improve their clinical abilities in a real-world setting without endangering human life. But first, here are some of the innovative uses of virtual reality in different sectors and industry. First is the entertainment industry. This is said to be the first industry to use virtual reality. Cinemas, theme parks, museums have now adapted virtual reality, using it to simulate movie-like experiences and let visitors experience their favorite motion pictures, sceneries, and other works of art. Next is education. Some schools offer virtual reality to be utilized in the students' learning experience. It is said to accelerate learning by enabling the students to study their lessons by experiencing real world without really being there physically. Now, in automotive industry, where virtual reality is widely used in the development of self-driving cars or smart cars, some brands like Honda now also offer virtual showrooms and demonstrations experiences for their consumers, which make it easier for them to explore the cars of their choice. Next, in occupational safety, using virtual reality, the professionals, such as those who work with machinery, can now plan their procedures and predict potential errors. Virtual reality makes it possible for the workers to go through simulations repeatedly with no additional cost and risk. This gives the workers a safe environment to work through proper procedures and improve their skills. And lastly, in healthcare, virtual reality is now able to be used in patient education and communication, mental and adjunctive therapy, pain management and physical therapy, and even medical training and disease diagnosis. Healthcare professionals can now use virtual reality in practicing complex procedures before conducting it in real life. It is also being utilized in some universities to train and let the nursing students experience clinical situations, which may increase their learning and confidence, and for them to also strengthen their skills before entering the real clinical world. And now for the discussion of the evidences, I now call on Ms. Kyla Estrada. Next, in occupational safety, using virtual reality, the professionals, such as those who work with machinery, can now plan their procedures and predict potential errors. Virtual reality makes it possible for the workers to go through simulations repeatedly with no additional cost and risk. This gives the workers a safe environment to work through proper procedures and improve their skills.
So now let's talk about the evidence-based statements about virtual reality. The first statement is, virtual reality provides nursing students a more accessible and innovative methods of teaching and learning. This statement is supported by the study of Saab et al. 2021 entitled Incorporating Virtual Reality in Nursing Education, a qualitative study of nursing students' perspectives. So in this study, they included nursing undergraduates as their participants. And these participants have experienced both virtual reality and the traditional learning. And after that, they were interviewed as part of the data gathering. And based on the results, majority of the participants agreed and supported the claim that virtual reality affords a novel, fun, memorable, inclusive, and engaging means of learning. Therefore, the researchers concluded that virtual reality technology has the potential to facilitate learning. The next statement is, virtual reality may improve knowledge but is not effective enough when pertaining to other areas such as confidence and performance time. So this statement is proven in the study of Chen et al. 2020 entitled Effectiveness of Virtual Reality in Nursing Education, Meta-analysis to evaluate the effectiveness of virtual reality in nursing education in the areas of knowledge, skills, satisfaction, confidence, and performance time. And the goal of this study is to determine if there are significant differences between the virtual reality and their control condition. And they have found out that there is a significant difference between virtual reality and their control conditions, but only in the area of knowledge. Meaning, virtual reality can improve the quality of knowledge or education, but it is not helpful enough in improving the skills and confidence of the nursing students. So the next statement is, virtual reality is a growing technology, but it still needs to be improved. Why? Because in the recent study of Leeds University, the researchers have found out that in just 20 minutes exposure to virtual reality could impair the child's ability to judge distance between objects. And also there are cases reported that there are users that have experienced dizziness, eye strains, nausea after wearing the headsets. The next statement is, in the context of COVID-19 pandemic, challenges to nursing education have resulted in an increased use of innovative technologies such as the virtual reality, and that is according to Maureen 2020. I personally have agreed to this statement because upon searching on the internet, I have found out that there are really some or a lot of learning institutions abroad that is actually now incorporating the virtual reality as part of their learning system. And some of the learning institutions that I have searched is the Indiana University and the Nursing Department of California State University. And lastly, despite the fact that the technology was developed decades ago, many people are still unfamiliar with the concept of virtual reality. However, there are some platforms that have been used to educate the public. If you have already watched The Good Doctor that was aired year 2017, they use virtual reality on some scenes of the movie to practice complex procedures. And I think movies like this is really helpful in introducing the virtual reality and increasing the awareness of the public about virtual reality. To sum it all, incorporating virtual reality in every learning institutions around the world will be helpful, especially in increasing the quality of nursing education, as it allows students to practice whenever frequently they want in safe and realistic situations without concern of making errors and injuring clients. On the other hand, virtual simulations needs collaboration, coordination, as well as time and money to build situations and educate teachers. Furthermore, long-term exposure to virtual reality can cause dizziness, migraines, and soreness while moving.
Stated here that simulation involving nurses who are currently treating and aiding patients in the field is taking place. As a result of their virtual experience, students have already gained the abilities that they will employ in actual scenarios.
Future directions. Nursing education puts theories into practice. During clinical practice, nursing students make medication mistakes, struggles to decide what interventions to undertake in unique settings, and have trouble interacting with patients or other healthcare professionals. However, first do no harm is a fundamental human right and ethical values that nurse should constantly keep in mind when doing treatments. Clinical environments can be outfitted with real-life laboratories, mannequins, and so on. Virtual reality simulation teaches nursing students what it is like to be in a real-world clinical setting and what challenges and risks they can face, allowing them to develop skills, build confidence, and prepare for clinical practice. The CATSIM Intravenous Training System, or CATSIM ITS, was developed in 1998 as the first implementation of VR in nursing. A CATSIM system includes software and a force feedback interface device. The platform device can be used and train healthcare providers to perform needle-stick medical procedures. For the use of VR in nursing education, in the field of medical education, virtual reality is defined as a sort of computer-based 3D stimulation that allows users to feel as if they are in a clinical setting where they can practice skills without putting patients at risk. According to research, the use of virtual reality increases the participants' motivation and confidence while decreasing intervention-related discomfort. Those students who are less anxious and have advanced abilities are most likely to complete activities efficiently and safely.
Aside from what Ms. Gregorio said, virtual reality also allows the student to practice as often as they want and witness their own mistakes in safe laboratory settings. So basically, virtual reality allows the student to enhance their skills and to learn from their mistakes. It also gives us unlimited chances so that we can develop our skills without harming our patient, since in virtual reality we don't encounter real patient. So as a result, active engagement simulations improve learning retention and enable participants to learn interactively and analyze problems. In nursing education, virtual reality serves as a link between theory and practice. According to research, virtual reality makes the learning more enjoyable and allows for active engagement through feedback, and it assists nursing students in acquiring knowledge and developing skills as well as making them more motivated and confident. Nursing education is a type of applied education. As a result, students must engage in both laboratory and clinical practice. However, due to their inexperience, students may endanger patients. Especially now in our situation, we don't have any experience yet in clinical settings, so we are considered inexperienced. However, VR may help us enhance our skills so we can lessen the possibilities that can put the patient at risk. According to research, virtual reality simulations assist students learn information, build teamwork and critical thinking abilities, recognize unique clinical circumstances, and effectively connect with patients. Nursing students who possess disabilities can provide safe care, correctly administer medications, and identify changes in their patients. Lastly, students who engage in VR simulations can provide patient safety in real clinics. That's all for the use of virtual reality in nursing education.
Here are some references that was used in our research. That concludes our presentation. Thank you for listening, and we hope that you gained some knowledge.